get the diagnostic number from the top. That is 24601. And the time is right at midnight. Marvelous. Good. And time to wake them. Hello there. Hello there. Hello there. Yes, apologies to wake you, but I am Nurse Luna, and I am here to perform what is known as a bedside exam. We call it a bedside head to toe exam. Yes, and in this exam, as it is so late in the night time, you are allowed to keep your eyes closed throughout the duration of it. And as well, there will only be one moment where I quickly check your eyes, which will be right now. I'm going to ask you carefully to look at me, darling. Good. Look at the light. Look over here. And can you look up? And look down. And just going to ask you to carefully follow the light for me. Marvelous. So now you can keep your eyes closed throughout the duration of the exam, as I've just carefully checked your eyes and your pupil reactions. Yes, good. Yes, indeed. And it looks like you are here in the clinic because you've been feeling a bit unwell. Is that true, darling? Yes. Okay. And can you recall to me what your symptoms currently are? As quite tired. I'm just going to get close to you, okay? Keep talking. Quite tired. A bit unwell. A bit. Yes, indeed. Just a bit down. Okay, well, we're here to take care of you and check all of your health from head to toe. Is that okay with you? Good. Again, I'm Nurse Luna. Yes. So first we're going to get some gloves on, and we are going to begin with just a couple of tests with your face, otherwise known as some visual light exams, and just a little bit of testing your cranial nerves, okay? Now, have you been watching a lot of television lately? Or perhaps you're on your phone quite a lot? Yes, I do know that a new Pokemon came out. Have you been playing? Yes, I have. I am Team Violet. Yes, nice. So, first what I'm going to do is I'm going to ask to carefully touch your face. Is that okay with you? Good. Just carefully, just going to okay, and just a bit there. Good, I don't sense any signs of fever or chills. Good. I'm going to take your heart rate and get your vitals. Is that okay with you? Good. So, I'm going to ask you just to relax and breathe in and breathe out, okay? Okay. So, it might be a bit cold. Okay. I'm going to place it right on either side of the shoulder blade, okay? Breathe in and breathe out. I'm going to place that right there, okay, and relax. Good. Good. And darling, you can close your eyes for the rest rest whilst I get your vitals and check your health, okay? Good. Breathe in. Just follow my instructions and breathe out. Very good. I'm going to place this right near the abdomen now. Just going to sense any sound of the stomach, okay? Good. Just relax. Very good. I'm going to place it right on your back, onto the shoulders, okay? Good. So just relax. I'm going to place this right onto the shoulders and just breathe in and breathe out. Good. Breathe in and breathe out. Very good. So it looks like signs of heart rate are average. Do you have any signs of anxiety at all? Are you okay? Good. If at any point you want me to change the exam, anything to make you feel more comfortable, let me know. Okay, darling? Good. Okay, next I'm going to get your temperature, okay? So, I have this little thermometer. I'm going to place it right along your forehead, okay? Good. Just sit still. You're going to hear just a little sound, okay? Just relax. Good. One more time. Good. And one more time. Good. So the average temperature for all of those was actively low, which is okay. It's a little cooler here. I'm going to write that down. And by any chance, have you been sleeping normally a full 8 hours of sleep? It's been a bit difficult for you. Have you been working or going to school? Okay, and is it close to the holidays? Okay. Good. Now, next for your vitals, I'm going to check your ears, your nose, and then your throat, okay? Good. So let me get that. So I have an otoscope here. I'm going to add an attachment to here. It's a little plastic lid. We're going to check your ears, okay? Good. Ears first. So let me get it. Perfect. Now I'm just going to check your ears. Is that okay with you? Good. Have you had any problems with your hearing lately? Do you wear headphones when you sleep? Yes. Just relax. I'm going to check your ears. Good. Just sit still. I'm going to quickly just examine. Okay. Okay. So this ear seems to be working okay. I'm going to get close to you. I'm going to whisper something on that side of your ear. Can you repeat the word back to me? Just follow my instructions. Good. So I'm going to whisper. Sunshine, sunshine, sunshine. And can you recognize what word I whispered to you? Sunshine. Marvelous. On to the next ear. I'm going to carefully just take a look here. Okay. And it looks you ever had that? Okay. I'm going to just carefully make sounds next to your ears. Let me know if you hear them by raising your hand, okay? Good. So, carefully going to place my hand here. Let me know if you hear it. Good. 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 Great. Good. And I'm going to carefully put pressure behind your ears, okay? Let me know if you feel any sense of imbalance or vertigo. Okay? Good. What I'm checking for here is any signs of calcium buildup. Okay. And could you hear those sounds? Yes or no? Good. I'm going to ask you to continue closing your eyes, okay? Continue closing your eyes, okay? And I'm going to test your ears. I'm going to tap on certain items and I want you to take a guess as to what those items could be. Answers are similar to something like you're tapping on glass, perhaps you're tapping on plastic, etc. Okay, good. So let's get the first item here. So, I'm going to just tap on something and I want you to take a guess what this is using just your ears, okay? Okay, any ideas? Good. I was tapping on plastic. It is a lid. Very good. On to the next one. Are you ready? Very good. Any guess? Good. Well, this one is glasses. I think these might be yours, maybe not. Okay. And I love the sound of these. Next, I'm going to get a set of tuning forks, and using just your mind, I want you to let me know if the sound is loud or quiet, or perhaps a high pitch or a low pitch. Okay? So now we have a set in front of me of something known as tuning forks. I will show you. And what I'm going to do is I'm going to just carefully tap on them, and I want you to let me know if the sound is a high pitch or a low pitch. Okay? Very good. So using just your ears. Good. Ready, begin. One more time. And could you hear that at all? Good. And if you could, can you tell me if that was a high pitch or a low pitch? A low one. in 1/28 chord C. On to the next one. High pitch or low pitch? Let me know. One more time. Very good. And was that a high pitch than the last time or a lower than the last time? Yes, a little bit higher. Very good. On to the last one here. Higher pitch or lower? One more time. Higher or lower? Very good. So it looks like your ears are well. Good. Next, I'm going to carefully take your blood pressure. And I always wait to do this vital just because after you've tested someone's heart, they can get a bit nervous. So I like to do a little bit of the relaxing exam first and then test the blood pressure, okay? Good. So I'm going to use one of your arms, okay? Good. Okay. And what I'm going to do is going to ask you if that feels okay. Good. I'm just going to put my stethoscope on your arm. Okay. Very good. I'm just going to allow air. Let's begin. Perfect. And taking a look at that, we're going to take a look with the perfect. Let's now just going to release the pressure. Very good. And if you can see, this is what I use to read the calculations. Now, looks like that is a perfect calculation. And a quick question for you. Do you wear glasses or have contact lenses? Yeah, I asked you earlier if these glasses were yours. Yeah, good. I'm going to write that down, darling. Very good. Now, what I'm going to do is carefully look into your nose and your mouth, okay? So, we're just going to add a little bit of a pen light. I'm going to ask you to relax, okay? I'm just going to just apply this right to each nostril. Good, let's take a look. Marvelous, perfect. And into the other, perfect, very good. And now if you could just say ah for me, very good. Just say ah. Just say ah, very good. Gonna take a quick look. Okay. Okay, marvelous. That looks fantastic. So, I'm now just going to quickly examine your skin. Okay. And have you fallen recently or done any workouts where perhaps you've done anything, or perhaps you've even laid on a pillow at an interesting interesting angle and it threw your balance off. Okay. I'm going to quickly examine through your scalp and your skin, okay? Is that okay with you? Take a look. Okay, very good. Good, and then relative to the face, just keep your eyes closed. I know it's quite late. I'm going to examine the skin. Good. Very good. Marvelous. Great. Good. Now what I'm going to do is I'm going to just so carefully test your cranial nerves. I have 2 more exams for that. So, I always test sense of smell and a skin sensitivity test. I have a tool here, and one side of it is soft and the other side is a little bit sharp. Keeping your eyes closed and following my instructions, okay? I'm going to just carefully place the object on either side of your face, and you let me know if it's soft or sharp, okay? Good. So, we're going to begin. Let me first tell you what soft is. I'm just going to carefully touch it on your face. Yes, you see? Perfect. And this one is sharp. Okay. And you understand the difference, correct? Good. Now let's begin. Let me know if it's soft or sharp. We'll begin with the first one, okay? Okay, and was that soft or sharp? Great, that was soft. Let's continue. For the second one, was that soft or sharp? Great, that was soft. Good. Let's continue. And for the third, was that soft or sharp? Sharp, very good. Let's continue right onto the chin. And for the fourth, was that soft or sharp? Soft, very good. And last but not least, your forehead, okay? Let's begin. And for the fifth, was that soft or sharp? Perfect, it was sharp. Very good. So it looks like your results are well. That's marvelous. Yes. Great. And last but not least, I'm just going to test your olfactory sensory nerves. I have 3 essential oils here. They all have different types of essential oils. Some are going to be more difficult to identify, and some will not. Are you ready to begin? Keep your eyes closed. I'm just going to place it carefully and quite close to your nose, okay? Let's begin. So, I'm going to ask you just to carefully. And what do you smell? A bit like mint. Good, a bit like, yes, kind of like a tea. Marvelous. And what do you think this is? Perfect. This one is actually eucalyptus. And mint was perfect. The smell of this eucalyptus is phenomenal. It reminds me of a type of tea I've had before in the past. Good job. Next, we have this one. I like this one a lot. Keep your eyes closed. Marvelous. So, this one is a bit more unique. You are smelling a bit of lemon, very good citrus, but it's a bit more like earthy and plant. Very good. Any guesses as to what this could be? Great. This one is actually lemongrass, but lemon was perfect. Good job. This one smells exactly like a candle shop. Yes, as if someone made a lemon candle. It smells great. Okay, and the last one's a bit difficult, but I know you'll get it, okay? This one I love and I adore. Oh, this one smells fantastic. So, I'm going to carefully just put that right next to your nose. And this one smells like what to you? Yes, a bit like a tree, a bit like a fireplace. Very good. And also smells a bit warm. Yes, kind of like a blanket or perhaps a cabin in the woods. Yes. So what would you guess it is? A bit like a wood. Very good. This one is sandalwood. And that's exactly what it is. So you did fantastic. Very good. And your health is looking magnificent. Thank you for allowing me to just go through the head to toe exam very carefully. And with haste, so that you can go right back to sleep. Yes, indeed. Again, I'm Nurse Luna. You do have a little button next to the side of your bed if you need to call me for anything. And do you need any more pillows whilst you're laying down? I definitely see that you could need a pillow, perhaps a blanket. Okay, so you're okay like this for now? Let me know if you need anything, okay, darling? You can just keep your eyes closed and go right back to sleep now. Perfect. And we will check up on you in the morning, okay? Good, fabulous. Now, we will see you in about 8 hours. Good. Anyways, I'm going to put all of this away now and have yourself a good night. Cheers, darling.